Hi, this is Dr. Walker. Welcome back to the channel, denwalker.com. Today I'll talk a little about the importance of D3 and K2 and why it's sort of a suggested combination. So D3 again has been known for a while to be a great anti-inflammatory and helps to correct some of the defects that can be caused by, quote, the virus. So for most people, the suggested amount, again, unless your levels are supremely low, so less than 20 nanograms per milliliter, the suggested amount for many people is about 5,000, especially in dark-skinned folks, 5,000 units per day, and get your levels checked in about 6 weeks. You can start higher in some articles I've read, 10,000 units. Again, the levels checked in 6 to 8 weeks and kind of see where those levels are. And for most people, I suggest that the level should be between 80 and 100 nanograms per milliliter. If you're less than 20 nanograms per milliliter, so you're vitamin D deficient, then what you may want to do is start with 10,000 and get your levels checked in a couple of weeks, and again, to get that goal, right? Some association between people who are vitamin D deficient, less than 20, and being hospitalized for viruses and those kind of things. So important to get D3. D3 is important because it tends to pull calcium from your blood. From your colon, from your bowel. You've eaten some food that has some calcium in it, let's say spinach, for example. It pulls that calcium from your bowel and puts it into your blood. Some people have mentioned in the past that too much calcium can be toxic to the body, and so elevated levels of vitamin D supplementation can be bad for the individual. And to some degree, I hear what folks are saying, but the issue is that calcium, once being pulled from the bowel via the vitamin D3, does not get excreted well like you would with, let's say, excess vitamin C or things like that. It does not get excreted very well. It stays in your serum, and so in your blood. And so sometimes people can actually get calcium stones from having too much calcium in your blood. You can get spillover into the kidneys, for example, and get kidney stones from that standpoint. Or if it's too much, it can get deposited into your blood vessels, atherosclerotic disease, or into your soft tissues and those kind of things. And so it tends to sort of get deposited into areas of the body, too much calcium, that's not really needed, right? You need the calcium, for example, in your bones, and hence the importance of K2. K2 helps to mobilize the calcium from your soft tissues and your vessels and coronary arteries, for example, into your bones where it needs to be, not in your soft tissues, not in your blood vessels and those kind of things. So K2 is important for mobilizing the excess, or mobilizing the calcium essentially from your blood, from your tissues and whatever else into your bones. And so people with osteopenia, osteoporosis, sometimes if they're treated with K2, that tends to help as well. K2 is high, for example, in cheese and cottage cheese and those things. And so if you're taking vitamin D3 and not K2 necessarily, you still get some support from eating cottage cheese or cheeses in general, or egg yolk and those kind of things. But I would suggest that if you're taking really any high levels of vitamin D3, let's say 5,000, 10,000 units, then you need some K2 with that. So for most people, if you're taking 5,000 units of 5,000 units of D3, then you need about 100 micrograms of K2. For 10,000 units of vitamin D3, you need about 200 micrograms of K2. So it helps to keep those ratios essentially in your head. Vitamin K2 can antagonize things like warfarin. So let your doctor know, especially if you're taking blood thinners for whatever reason, let your doctor know that as well, so you're not having any complications from that. But again, importance of vitamin D3 and K2. Again, D3 is supremely important. That's really a supplement you should be taking every day. Dark-skinned people tend to have more of an issue with the conversion of the inactive form of vitamin D to active form of vitamin D. So they tend to need more. I take 10,000 units every day myself. And again, it's just for my personal protection, and it's a hormone that does a lot of things for a lot of folks. But if your levels are too low, then you may have some complications. So get those levels up and supplement that with K2. And again, K2 is, again, very important to mobilizing the excess calcium from your soft tissues and your blood vessels and those things into your bones where it needs to be. So It's a great treatment as well for folks that have osteoporosis and osteopenia. Anyway, try that. Let me know what your levels are in a couple of weeks if you are in high levels of D3, again, for the protection that it offers, and add a little bit of K2 to help that process as well. Thanks for listening, Dr. Walker.